Hey, welcome back to our channel. We hope you guys are excited to begin a new phase of your life soon.
You guys must have started working on practical matters like visa, flight tickets, insurance, and housing. In this video, we'll cover one of those matters, that is your health insurance.
We will talk about why the insurance is required, how does your insurance change when you're working or doing an internship along with your studies.
To find out the answers to all these questions, please keep on watching. But before that, please subscribe to our channel if you haven't already.
As mentioned in our previous video named 8 Initial Expenses in the Netherlands, insurance is one of the expenses which will incur when you are moving to the Netherlands.
So similar to our last video, we will cover today's topic by question by question instead of point by point. Also, you can read all about this on our blog, the link to which is down in the description box.
We have also designed a printable chart that will help you get right insurance for yourself.
Alright, now without any further ado, let's start with the questions.
Question 1. So Harshil, why do I need a health insurance?
Okay, it is understandable why you guys might have this question. You may be very healthy and might not visit doctors that often. Thus the premium of insurance, it might look very expensive to you.
But not buying a health insurance because of the premium cost is a gamble that you might end up losing if you get injured or seriously ill.
Trust us guys, the biggest advantage is to have financial protection and that peace of mind of knowing that you can get access to affordable health care whenever you need it.
Also, in the Netherlands, it is mandatory to take health insurance within 4 months of getting a residence permit.
So you don't have a choice. If you fail to do so, you may receive a letter from CAK Netherlands stating that you are uninsured and you will be fined.
CAK Netherlands is a government organization responsible for uninsured regulations. They send out letters, issue fines and take further actions to get you insured.
The fine for not having an insurance is around 410 euros. So not getting a health insurance for yourself is really not an option. You absolutely need it.
Question 2. What is Dutch insurance and private insurance?
So the health insurance system in the Netherlands, it is based on the principle of social solidarity.
Together, Dutch people pay the overall cost of healthcare. Everyone contributes to the health system, and this is what the Dutch insurance means.
It is overseen by the Dutch government and policies offered by the insurance companies, they are very much regulated.
The Dutch government decides on the cover provided by the different insurers.
Healthcare insurers are obliged to accept anyone who applies for the standard insurance package and must charge all policy holders the same premium regardless of their age or state of health.
Private insurance, on the other hand, is not controlled by the Dutch government.
The cost and coverage of the insurance offered by these companies will vary. It is up to you which policy to buy. Allianz and Aon are some of the famous private insurance providers here in the Netherlands.
Check out the description box for the links to these private insurance companies.
Okay, now I get to ask a question. So which one should I take? Dutch health insurance or private health insurance?
International students are not always required to take out Dutch health insurance.
So whether you are required to or not depends on several factors such as the duration of your stay, if you're doing an internship or working, and whether you have insurance in your home country.
If you are a non-European student and you are not working during your studies, then you cannot take Dutch public health insurance. Your best option is to take out private health insurance.
So yeah, that's sad, but on the bright side, we have linked a portal where you can compare different private insurance options.
Additionally, your university will also let you know about which insurance is best suited for you. And in our opinion, always go with the option suggested by your university.
But if you're a non-European student and if you're working, then you will need a Dutch insurance, and in that way you can also apply for a healthcare allowance. So yeah, it all works out well in the end.
Question 4. What steps are necessary to get basic Dutch healthcare insurance?
So for European students, there are 3 steps, yes, a list, which you need to take to get your basic Dutch healthcare insurance. Step 1. Make sure you're eligible for Dutch health insurance. We have put the links in the description box where you can check whether you're eligible or not.
2. Compare different health insurance policies. Again, you can find all the links in the description box below.
3. Choose and apply for a Dutch insurance online.
for non-European students, please follow the following steps. Step 1. Apply for the residence permit at IND. Well, the chances are you already have a residence permit with you at this point.
Now, in our previous video, if you haven't, then we have explained in detail the steps to get your visa and residence permit. So if you haven't watched that video and you still don't have a residence permit, then go and watch it.
Step 2. Once your registration at the IND is successful, you can go to local town hall in the city you are residing and register yourself as a new inhabitant. You will then receive a citizen service number, also known as BSN.
So step 3, once you have your BSN, you can compare and select your own basic Dutch health insurance. In addition to the basic package, you can choose supplemental health cover, which we will discuss in the latter part of this video.
Question 5. What medical costs does the basic health insurance cover?
Very valid and very important question. So if you have taken private health insurance, then medical cost coverage depends on the insurance company. Please go through the coverage list before buying insurance.
Make sure the policy you are buying meets all your necessities. If you have any specific medical condition for which you need to visit the hospital, then verify if it is covered by the policy or not.
This is very important because the hospital visits in the Netherlands can be expensive if you do not have proper health coverage.
If you have a basic Dutch health insurance, then it covers all the essential healthcare such as visits and treatment by the general practitioner, pharmaceuticals and basic hospital treatments.
Now, within the Dutch healthcare system, you are also entitled to long-term care and social support care.
We have created the complete list of medical services covered by the Dutch health insurance. You can find it on our blog.
Question 6. Now, the best one. Can I get healthcare allowances?
If you are an international student with Dutch healthcare insurance, then the answer is yes. But there are several requirements to be met to be eligible for this allowance.
So here's another list which will mention you all the requirements.
You are 18 years or older.
You have Dutch health insurance.
You have a Dutch citizenship number.
That is the BSN.
BSN, yeah.
And then the fourth one, your yearly salary is below 29,000 euros.
Question 7. What's the next step after choosing insurance?
So after you have chosen your Dutch health insurance provider, you should register with a general practitioner or GP for short. This is the first point of contact in getting healthcare in the Netherlands.
Keep in mind that this is very important step once you land in the Netherlands, because if you fall ill and you're not registered at the GP, then it will be very difficult for you to find a nearby doctor who is taking patients.
The doctors usually see patients who are registered with them and have an appointment. Thus, make sure you register at GP as soon as you get your insurance.
Question 8. How do I find a GP and make an appointment?
We have provided a link to the portal where you can enter your zip code, Netherlands zip code, and get nearby doctors. Once you choose the doctor of your preference, you can register yourself with that GP.
Another option is to visit your town hall. There you can request a booklet issued by the municipality which contains information about all the local GPs, sports groups, daycare and etc.
So once you've registered yourself at the GP of your choice, you can make an appointment by directly calling them. Many GPs have consultation hours where you do not need an appointment and you can, just directly walk in and speak to the doctors. But the timings of such consultation hours, they vary from GP to GP, so just check that beforehand.
If you need an appointment with a specialist, you first need to visit your GP, and then after assessing your situation, the GP will refer you to the specialist. You will also need to show this referral to your insurance company if you wish your cost to be recovered.
So we hope you find all the answers. You have found all the answers to your questions. If we missed answering any question or if you have any future video request, then please let us know in the comment box.